We all want to create change, but have you ever just felt stuck? Like you want to make a difference, but you don't know where to start, or no matter how hard you try, nothing seems to be working. Well, you're not alone. Turning good intentions into real lasting impact is hard, especially when you're up against complex issues, limited resources, and what feels like barrier after barrier. In this episode, we're talking through an evidence based blueprint designed to help youth serving professionals like you move from feeling stuck to taking meaningful action. It's a practical tool built by people already doing the work, grounded in research, real world experience, and deep understanding of what it actually takes to move the needle towards healthier change outcomes. Because when you have a clear plan and the right support behind it, we're not just getting started, we start to see results. Let's get into it. We're meeting with real leaders shaping a healthier future for our young people. We dig into what motivates them and how their work makes a difference. I'm CJ Sturmer, and this is the Champions for Youth podcast. Hi, Michael. Thank you so much for joining me today. I really appreciate your time.
Hello, CJ. Thank you so much for having me.
So, Michael, you work for the Virginia Foundation for Healthy Youth and Prevention Connections, who graciously support this podcast, and we have been working with for quite some time. And you've also had an illustrious career working with young people in multiple capacities. I'd love to hear a little bit more about what has motivated you to spend your career helping young people in this country.
Sure thing. So my educational and career background, I think, are largely the intersection of public policy and social work. So I have a degree in public policy and administration, and then I have a bachelor's of social work and a master's of social work. And most of what I've done in my adult career has been working with children or families, especially those work in poverty. And so this has involved young people who were in public housing, young people in the care of the foster system, and most recently, young people who need extra support for health and wellness. And so if there's a through line throughout my work, it's trying to make sure that young people are safe and healthy and happy and are flourishing. And so working at the foundation and volunteering with Prevention Connections has just been a really great chance to amplify that work.
That's incredible. So there may be some people out there that aren't as familiar with the Virginia Foundation for Healthy Youth and Prevention Connections. Tell us just a little bit more about that. Who are these organizations and what do they do?
Sure thing. So I'm director of programs for the Virginia Foundation for Healthy Youth, and I'm also serving as board chair for Prevention Connections, 1C3 nonprofit organization. And so the foundation was established 25 years ago as a result of a big settlement agreement between the major manufacturers of tobacco products and most of the states across the country. And as one component of that big settlement, funding every year is taken from the tobacco companies and given to Virginia. And Virginia chooses to give a portion of that annual fund to the foundation to support youth prevention efforts. And way back 25 years ago, our mission was really narrowly focused on youth tobacco use prevention. But in the intervening 25 years, our mission has been expanded to include youth tobacco use prevention, but also youth substance use prevention more broadly, finally, childhood obesity. And at around the same time that the foundation was established, they also stood up Prevention Connections as an independent C3 organization. There are roles and responsibilities that nonprofits can do that are separate from state entities. And so it's been a really wonderful partnership over 25 years where the nonprofit and the government agency can each in their own way support and bolster the other's work. And one of the really big notable ways that they work together is around the Champions for Youth Summit. It's a really incredible event outside of Washington, D.C. that brings together prevention specialists and researchers from all across the country to share best practices, cutting edge information. And the through line there is youth health and wellness. And then the other really big way that Prevention Connections and the Virginia Foundation for Healthy Youth work together is around childhood obesity prevention. And actually, when I was working at the foundation and trying to figure out a way to improve our grant funding around obesity prevention, I stumbled upon something called the Action Plan for a Healthy Virginia that I loved so much that I ended up stealing it and incorporating much of it into the DNA of the foundation's childhood obesity prevention funding. And I learned later on that that document was actually created by Prevention Connections and published for the first time in 2019. And so since that time, I've joined the board and we've really worked close together as two separate organizations with very similar missions.
Fascinating. So You discovered this action plan for Healthy Virginia.
Mhm.
I'm kind of curious, why was that created to begin with?
That's a really great question. So I think it's helpful to take a step back and talk about what it is we're trying to do. The mission of the foundation and of PC is to address childhood obesity. And that is a really multifaceted public health issue that it can be really hard to talk about it, to get your arms around it because there are so many different causes and it's such a complex problem. It could even be somewhat dispiriting if you're trying to figure out how do I solve this gigantic multifaceted problem. And so, what Prevention Connections did way back in 2019, and what the foundation does today, is take a step backwards and look upstream. So, instead of just trying to tackle childhood obesity prevention all at once, they've elevated the positive behaviors that can negatively impact childhood obesity and overall improve youth health and wellness. And suddenly, instead of just talking about childhood obesity prevention as this big nebulous thing, we can start talking about these really concrete and specific healthy behaviors. They laid out 8 healthy behaviors. They brought together researchers and practitioners from all across the state to try to create a document that is easy to use, that lays out very clearly strategies to support each of these behaviors across different domains. And so the purpose of this document is to have a one place for people to go to if they want to figure out the best policies, the best systems, and the best environmental changes to make these behaviors more likely. So that's sort of the whole point of the action plan is
Right.
to lay them out in a clear, easy to read format.
I think you bring up a really good point. I don't think it's a secret that childhood obesity is on a rise still in our country. I think data shows that the pandemic has made it worse. And a lot of times when I talk to people about nutrition education and childhood obesity prevention, everyone sort of approaches it differently, which you hinted at. And so I think it's a really good idea to like you said, take the step back because it is this nebulous thing. People think about it differently just depending on their work. And often when I talk to people, I find that people are trying to recreate the wheel. They're constantly trying to approach it in a vacuum. Would you say that this document helps to sort of address those issues so that when people create things like campaigns or create policy or, I don't know, even communications plans, how does that provide some sort of standardization? So even just when people start approaching the issue, they're not just recreating their own wheel of something that already exists.
Absolutely. I think that there's so much good work happening all across the state and all across the country that touches on childhood obesity prevention, but we have an alignment problem. So there
Uh,
actually are some really tangible things that you can do. You have some control over a specific environment, whether it's a daycare, a hospital, a restaurant, your own home, that are evidence based, that are well established. And what the action plan does, it lifts these strategies up so that organizations all across the state and even across the country can better align their priorities. And suddenly it
uh,
becomes a lot easier to coordinate different coalitions, to talk about different ideas that you're putting into practice, and to share results. And so one really great thing that we have as a partnership between the foundation and PC with the action plan is that as of a few years ago, there are now 30 collaboratives located all across Virginia with
oh,
long
wow.
term grant funding from the Virginia Foundation for Healthy Youth. We call these collaboratives Healthy Communities Action Teams, or HCATs for short, because that's a lot to say. But all 30 of these collaboratives are now working across Virginia to influence local policies and systems and environments to make the healthier choice the easier choice. And all 30 of these collaboratives are now aligned with Prevention Connections Action Plan for a Healthy Virginia. To say it a different way, all of these collaboratives are working every single day to influence at least one or more of these 8 healthy behaviors, and they're starting to work together now. And you don't have to be a funded organization from the foundation to plug in.
Oh, interesting. Okay, so what you're saying is there's 8 specific areas that you all are sort of setting the foundation with this action plan. And then there are 30 of these groups that are working within one or more of these specific, let's call them topic areas within this action plan. That's interesting. So you're getting all of this sort of seat at the table of people that are doing things that are actually already working, coming together to bridge those gaps and to not recreate each other's wheel, but to say, hey, here's what we're doing across all the tables so that we can get a bigger picture of these 8 specific things.
Exactly right. And just to call them out, because they're really tangible. So the 8 behaviors are breastfeeding, eating more fruits and vegetables, reducing the consumption of ultra processed, sometimes called energy dense foods, moving more, decreasing screen time, getting enough sleep at night, reducing stress, and decreasing the consumption of sugar sweetened beverages. These are really simple behaviors.
Yeah, that is really simple. It's hearing that I see how it can really stretch across all sorts of different people and communities that work with young people. Like you said, like people that are creating policy around these issues, people that work with, really early childhood education or education through high school. And I like that you even said things like restaurants, right? Like that is such a wide range of groups of people that could really tap into these topic areas, which that's fascinating. One of the things we hear a lot is people are concerned about funding. People are concerned about how expensive these things are and how that can be a barrier for them. When you talk to these groups and when they're actually facilitating programs or plans or policy or whatever it may be, how expensive is this getting for people?
It really depends on the activity and the domain. The problem of childhood obesity is very complex and multifaceted. Many of the solutions don't have to be expensive. In fact, you'll find that most of the recommended solutions that we have are shifts, slight shifts in environment, slight shifts in policy, slight shifts in the systems that surround kids. And so what the action plan does so well is it lifts up 8 behaviors and then it lifts up 9 environments. These environments are places like
Fascinating.
early child care centers, restaurants, healthcare facilities, religious organizations, your home, the first and best place to teach a child. And so these are 9 different domains that everybody has some control over. And so if you have some control over this environment, you can go right to the action plan and figure out well-researched, evidence-based strategies to make the healthier choice, the easier choice in that environment. And for the most part, these don't have to be very expensive shifts. How do you incentivize whatever domain you have, whether it's your sports team, your religious organization, your after school program, your school district? How do you make it more likely that when a young person reaches for something to drink when they're thirsty, it's a glass of water and not a sports drink or a soda? That doesn't have to be expensive, but it does have to be intentional.
Right. I like how you said intentional. Intentionality is one of our favorite words here. You just have to focus on that one thing, and we've talked about in some previous episodes. It just takes practice. It's not
Mhm.
you can't just do it one time and say, "Oh, well, it's not working." It does take practice, and something is so simple as offering water more often. So what you're saying, it's sure it may be a little bit of cost, but it could be something as so simple as free. I like also how you said that this is for at home. So this could impact families too, not just young people of all ages, but it actually could change the behavior of an entire family.
Absolutely. And like with anything involving prevention, the younger that you work on this, the more impactful the results. And all of these behaviors really do influence each other. So you're starting your foundation with getting a good night's sleep, with drinking water, with eating nutritious food, the mental health, the exercise, it's all connected. And if you could incorporate these behaviors more before the age of 5, all the better. So the action plan, you'll see a broad range of ages included, everything from birth with breastfeeding all the way through to the older teens. There's strategies for all levels.
Right. I think you brought up another really good point is how easy and obtainable these small changes in the environment can be. When I was reading the action plan and I was looking at the recommendations, they weren't complicated. It was really, really simple things like you mentioned water, offering different options. Sleep is another one I think that you mentioned. I don't think a lot of people think about sleep when you're thinking about obesity prevention. I think it's like, oh, we'll just switch to different nutritious sort of options and, of course, get people to move more. We've talked to some other folks on episodes here that are doing that as well. But it's easy and so obtainable. We're not asking you to develop massive communications campaigns. It's literally small, super small steps. Michael, when people start to put these recommendations and change the environment into actions, what are you all seeing?
So I think we'll announce today that we're actually relaunching the action plan now, and it should be available as soon as this podcast launches. But one of the really cool things that the newest iteration of the action plan does is that it incorporates data, statewide trend data from the past 10 years. And the really great thing about these behaviors is that each of them has at least one statewide representative indicator. We can actually track how well kids are doing making these decisions over time, at least here in Virginia. And that's thanks to bringing in the results of the Virginia Youth Survey, which is coordinated by the Centers for Disease
Yeah.
Control, initiated by the Virginia Department of Health with support from the Virginia Foundation for Healthy Youth. And so for each of these 8 behaviors, we have an indicator for each of them that spans at least a few years, if not 10 years.
So it's pretty legitimate.
Absolutely. This is a random sampling of public middle school students and public high school students. It's anonymous, and CDC helps us to coordinate this survey along with many other states across the country.
Got it. So the data that you all are obtaining is measuring behavior change within these students that are receiving some of these small environmental changes based on this guide. And this is legitimate data acquisition. It's not like you guys are just writing some random questions. Like these are based on some pretty high level
They
guidelines.
are, and this is statewide. This is how we could see trends that affect the entire state of Virginia.
Right, which is environmental. What happens, in Western Virginia isn't necessarily what happens in places like more rural areas or versus sort of
Exactly
the
right.
coastline. Like those are very different environments. Those are different cultures. Those are different types of communities. So it really helps encompass everyone in the state of Virginia. Michael, this is something that I'm not aware of, so I'm kind of curious. Based on these guidelines, and if someone around the country were to take this action plan and were to implement it for themselves, is this evaluation format, evaluation process, is that readily available so anyone in any state could also help to measure those changes within their own public school system?
There is likely an equivalent survey in most other states, and if anybody's interested, I'm happily to crosswalk the questions that we asked. Many other
Fascinating.
states are also coordinated by CDC to do a risk behavior analysis survey that's very similar to the one that we give. There can be some differences in questions, but it's likely that many of the questions that we ask, other states ask in exactly the same way, which is really useful
Right.
for benchmarking.
Right. So we have to
Mhm.
benchmark, and then we need to conduct the studies again over time to show what those shifts in behaviors are. I'm
Mhm.
curious, what are you seeing in these shifts in behavior? So are they significant?
Behavior changes tends to be small and it sort of builds over time. And so I know that you've done a really great job of elevating some of the organizations and the personalities who are aligned with the action plan already. I think recent episodes you focused on Move to Learn, a really great organization in Northern Virginia that helps to embed physical activity as just a natural part of the school day. Kids need to move a lot, especially young kids, and they do a great job just making sure that that is part of their policies, part of their systems, and part of those kids' environments. You had a similar story, I think, that came out around water access, making sure that kids by default are reaching for that glass of water. That's just part of their everyday behavior. These are a couple examples of all of the different activities that are starting to be aligned all across Virginia.
Right. So you all heard it. We have previous episodes if you want to hear more about the success stories of these actual programs. Move to Learn with Brooke, and we also talked to Melanie Bean, talk about the Hydrate program. So you all go back and listen to those episodes to hear some success stories there. So we've done this survey. We actually have programs that are happening in Virginia. Are these survey results, are they shifting positively, or are there some areas that we're seeing that we need to do more work?
Yeah, if we look all across the state at a 20,000-foot level, there are some areas that are relative bright spots and areas of concern. So, just to lift up one behavior that's actually getting measurably better over the past 10 years, it's reducing the consumption of sugar sweetened beverages, at least in Virginia. That's actually gotten a little bit better, which I think is really encouraging. That's one of the big things that the foundation focuses on is telling kids and families that water tends to be the best drink in almost any situation. Not sports drinks, not sodas, not juice, but water. It's the best thing to choose. But there are other places where the results are mixed. For example, when we measure teens' self-reporting of getting enough sleep at night, it's actually gotten a little bit worse. And that's not entirely surprising. You could imagine other things that are competing for time that prevent a young person from getting enough sleep at night. And so if you have some control over one of those 9 environments, whether it's your household, a restaurant, a school, an after school program, an early childcare center, you can use this guide to start thinking through how can I shift even slightly the systems, the policies, and the environments that our kids are embedded in to make sure that it's easier for them to get enough sleep. That could be adjusting start times of programs. It's easier for them to get the nutritious food that is bright and colorful and enticing. It's easier for them to get exercise as just part of their everyday. Just to give a quick anecdote, I took my kids out for dinner recently at a sit down restaurant and we ordered milks for them. And the waitress automatically asked, did we mean chocolate milk? And we said, no, just regular milks. And then she brought the 2 glasses of milk back to us. And each glass had a really large branded straw that was full of cookies and granulated sugar and flavoring. And so the only way to get the milk
Wow.
was to suck it through a very cool, very pretty straw. And so it just turned the milk into a sugar sweetened beverage again. And so the point of telling that story is not to demonize the restaurant, but just to say that somebody consciously or unconsciously decided that there's going to be a choice architecture for kids. And if somebody asks for milk, you can offer them chocolate milk. And if they decline, at the very least, you can give them a straw full of sugar. So
Right.
that's a
Oh,
very small example. But if you have some control over that environment or your home environment or a school environment, can you think through the choices that are offered to young people every single day and how you might be able to at least shift the choices a little bit to bias it towards health and away from poor health?
right. And we've talked about that before. Like there's this element of education that has
Mhm.
to go into it. It's not just here are things that you can do, but education is a big component of it. Like you said, we're not going to demonize the restaurant or anything, but there's just this education component. Like you, as the parent, are familiar with that transition because you've been educated on it. So it's like, hey, I want a regular straw because I know that that is something that I could do because I'm familiar with how those different variables can change things. You also mentioned the hydrate program that you all do at the foundation, which it's called Rev Your Bev. You all, it's been around for a while, and I have the commercial in my head, and it's water, 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 drink, and it talks about putting fruit in it. It's in my head. It's such a fun message and a fun video that you guys put out, and it's done through a partnership with the rescue agency, Jeff Jordan, who we've actually had on here before, talking about the benefits and the power of certain behavior change campaigns. So I love that it's full circle there and the partnerships that you guys are creating. So you're not reinventing the wheel, you're talking to experts that do it. And that's what we want, right? Like we want these programs to be embedded in our brains.
Absolutely. And the foundation intentionally works with early child care centers all across Virginia to get that message out at an incredibly young age that as soon as you can start drinking, other liquids besides breast milk or formula, water should be the default, water and milk, and not juice, not sodas, not sports drinks, but water. And if you start that at an earlier age, you build that healthy habit. You don't have to unlearn the behavior. Like we said before,
Right.
prevention is always more effective when you can catch somebody early on while they're still building their habits.
That's a good point. Intentionally building new habits based on the education that people receive and informing them of how they can change the environments in small ways that do not cost anything. So that's kind of to
Absolutely.
sum it up. Like that's obtainable. That's something that we can really, really do. And again, anywhere. Michael, how do we empower people to think differently? What is it that we can do specifically with using this guide? Is this accessible to other people?
So I think we can announce now that we have just released the very first update to the action plan ever. So we released it in 2019. We spent about a year and a half or almost 2 years revising the action plan, updating all the data, sharpening the strategies, shortening it. It's actually even shorter than it was before. It's an even leaner
Great.
document. And the whole point is that you don't have to read it cover to cover. You're welcome to, but you don't have to. If you work with schools, go to the school section. You work with early child care centers, go there. If you are an employer, go there. And you're going to quickly see all the strategies that you can implement right away that can positively impact these behaviors. Some of them can cost money. It can be expensive for a school district to have enough industrial ovens and industrial freezers and staff to prep food. So we don't want to sugarcoat it. But many of these are simple strategies. If you're an employer and you want to make it easy for your employees to express milk at your work site, do you have a room that they can go to that's private with a door that locks? Yes or no? Do you have a sink that they can use to clean their pump parts? Yes or no? Even if you have those, you have a place for them to store milk in a refrigerator? Yes or
Right.
no? So the point is just to say, how easy or hard do you make the healthier choice? And so, how much effort does somebody have to take to make that healthier choice? Is it the default or does it require a great deal of effort?
Right. And to those listening, I have read this document. It is really, really easy. And it's a quick read. Like you're right. It was not complicated to understand. And you don't have to read every single thing, like in all the 8 behaviors. If breastfeeding is something, even in your workplace, that you can make easier and more obtainable, there's a section for that. You could just talk about that. And there's some really good data points that you all are providing in those shifts. That information is readily available. So I encourage folks to read it. Michael, how can anybody listening today actually obtain this document? Where do people find it?
So, like all materials we produce, it's available free of charge to anybody. You can go to the preventionconnections.org website and click on Action Plan, and you'll get it right there.
Oh,
It's as
that's really
simple as
easy.
possible. Yeah,
Great. So we'll provide the link to this specific document in the show notes. So go to the show notes wherever you listen and click on it, and you can immediately download it right now.
absolutely. So basically, everybody listening to this has some control over an environment, whether you're an organization leader, whether you work in a classroom, whether you work at a place of business. Everybody has a role to play in supporting youth health and wellness and childhood obesity prevention. These behaviors touch basically every aspect of society. And so if you're not sure if you're working in the field, I think that you probably are. If you want to learn how you can best connect with this plan, how you can help coordinate your efforts, look at the action plan, find which environment best fits you, and then see which behaviors you might be able to influence. This is a great way to align your efforts with other organizations. As I mentioned previously, there's at least 30 large collaboratives all across Virginia who are already aligned with this action plan. You could find them by going to Virginia Foundation for Healthy Youth to learn more about connecting with them and supporting their mission. You could start your own organization, or you can just think through how you best can support the systems and the environments that you have control over to make the healthier choice the easier choice.
Right. So don't work in a vacuum, everyone. Don't sit there and trying to work in your own area and shift these all behaviors. Work with partnerships. That was the success of this document, and the behaviors are seeing shift because people work together. 30 people is a lot of people, but you don't have to work with that many people. You can work with just a couple people you have access to. If you're an educator, work with the home. If you work in a business, work with changing the way the business works so that your employees can also think differently. There's so many easy collaborations that you can do. Michael, this is absolutely fascinating. You all go download this document, figure out how you can change small little behaviors that do not cost anything in your own environments to help our young people and these families, even in the home. Michael, this was a great conversation. Thank you to you and some of the other collaborators that I know listen to this for really helping us shift these behaviors and make small increment changes to improve the health of our young people. Great conversation, Michael. I really appreciate your time.
DJ, thank you for having me on.
A huge thank you to the Virginia Foundation for Healthy Youth and Prevention Connections for their support, and thanks to Mauricio Reyes for creating that great music score. Don't forget to share this with others, because the only way we can make real change is if we do it together. And hey, if you like today's conversation, go ahead and give us that 5-star review. Now go out there, everybody, go do good. Thanks for listening. We'll see you next time.